Well, another community that has come under fire from the Trump administration after the president signed executive orders targeting gender ideology. It's a campaign promise fulfilled, but it's also creating fear and confusion among LGBTQ plus community. In the midst of the uncertainty, one local group vows to continue gender-affirming care for its clients in Lane County. NBC 16's Gold Meadows has the story.
On day one in office, President Trump made good on campaign promises pertaining to gender ideology, signing an executive order for the federal government to define sex as male and female. In his first weeks in office, the president also signed an EO ending federal support to hospitals for providing gender transitioning care to anyone under 19. HIV Alliance says though it has some federal funding, it plans to continue offering gender-affirming care even to patients as young as 18.
I can assure people that HIV Alliance is continuing to provide care. It's really important to us that people know that we're here and that people let their representatives know how important their care and services are and why the executive orders are causing concern and fear.
HIV Alliance has a low-barrier clinic in Eugene that helps clients with things like housing assistance and health costs.
If people don't feel safe and comfortable to access those things, we will see, an increase in HIV infections. There's a variety of concerns when people can't access the care that they need. Behavioral health conditions will become worse. That's suicide rates.
During his campaign for a second term in the White House, Trump called it the left-wing gender insanity being pushed on children, labeling gender-affirming care an act of child abuse. He vowed to stop the chemical, physical, and emotional mutilation of youth by revoking gender-affirming care. A University of Oregon political science professor says this could produce a storm of legal cases for hospitals.
They haven't even been tested in the courts yet, so we don't really even know if they violate the Constitution or if they violate existing federal law or whether there's conflicts between federal law and state law. It would be really advisable for hospitals to sort of hold steady to see whether these executive orders are even legal. Hospitals have already moved forward, in some cases canceling surgeries, in some cases ending gender-affirming care altogether for their patients under 19.
On Monday, New York Attorney General Letitia James let hospitals in the state know it would violate state law if they stopped offering gender-affirming care to those under 19.
Oregon law is very similar to New York law in the sense that they have an anti-discrimination measure that specifically calls out gender and sexuality. We need to let the courts sort this out. We need to let science prevail in these questions. There's a lot in the news of organizations that are caving, right? Organizations that are ending DEI, organizations that are ending gender-affirming care. But there's also a lot of organizations that aren't.
Gash says people opposed to Trump's actions should search out organizations and communities that are standing by the LGBTQ plus community. In Lane County, I'm Gold Meadows.
Now, Trump also addressed gender ideology in the education system, signing an executive order that blocks schools receiving federal funding from including gender ideology in the classroom.